Hello, and thank you for looking at my presentation on Hurler syndrome. My name is Seth Bodkins, and I appreciate your time. We'll go ahead and get started. As you can see from my first slide, Hurler syndrome is a genetic disorder. It's a rare genetic disorder. It's also known as alpha L iduronate deficiency. Now, this is considered a genetic disease because in order to get the disease, both of your parents have to be at least carriers, not necessarily directly affected by the disease, but they must be carriers in order for you to receive the gene necessary to contract Hurler syndrome. Move to slide 2. This Hurler syndrome itself is an inability to break down specific sugar chains. To be more descriptive, it's actually mucopolysaccharides is the specific kind of sugar chain. These specific sugar chains are broken down by an enzyme, lysosomal alpha L iduronate, which is also referred to as IDUA, which is much easier to say. The lack of this specific enzyme is what gives your body the inability to break down the sugar chains. This specific disease, Hurler syndrome, it falls into a disease class of a mucopolysaccharidosis, or MPS. So you'll see it referred to as MPS anywhere you go, or on any websites or books, or any type of support groups. It's always referred to as MPS. It was named after the pediatrician who first determined the disease in 1919. So the disease has not been identified for that long, almost 100 years. But as far as diseases go, it has not been it has not been diagnosed that long ago. Move on to slide 3. The harmful effects of Hurler syndrome they range in a lot. Most of them are physical as well as mental, and they range from severe to very life-threatening or fatal. It's caused because when these sugar chains build up in our body, they start to cause organ damage. As you can see from the picture, the abnormal bones are huge. It ranges from the spine to the skull, and obviously in the face, the claw hand is also an example of harmful bone changes. Clouded corneas, deafness, halted growth, joint disease, thick coarse facial features, and low nasal bridge, which are telltale signs of the Hurler syndrome. Also, they may have heart problems, weakened heart valves, and mental retardation that begins at a young age and continues to get worse as the child grows older. You can move on to slide 4. Diagnosis is something that it's very easy to diagnose. Hurler syndrome. Doctors use an EKG to check and see if the person's heart is being affected by the large amount of the sugar chains in their body. And they also use DNA testing to scan for the specific gene of Hurler syndrome. They use spinal x-rays as well to determine whether the patient has been affected by the Hurler syndrome and the abnormal bones is formed in the spine. Prevalence is not huge. It is rare. Over 100,000 people are born every year. So globally, that's not a whole lot. It sounds like a lot, but globally, it's not a whole lot of people. But the symptoms show up between ages 3 and 8. And as I said earlier, both parents have to be carriers in order to transmit the disease. So that's one of the reasons that it is so rare. We can move on to slide 5. Hurler prevention comes down to basically one thing, and that is genetic counseling. Genetic counseling is where you find out basically your family history concerning Hurlers. If your father or mother or their father or mother, obviously were carriers, then you are potentially a carrier. As you can see from the graphic here, that if two people are unaffected carriers. So they do carry the hurler gene, but they are not affected by the disease. There's a 1 in 4 chance that their child will be completely unaffected and not a carrier. 2 in 4 chance that they will be unaffected with a carrier, and a 1 in 4 chance that they are in fact affected by the disease as well as being a carrier. So the best thing to do in prevention of hurlers is understanding your family history and understanding whether you, in fact, are at risk to transmit Hurler's syndrome to your offspring. Move on to slide 6. The treatment for Hurler syndrome is basically in 3 things. Bone marrow transplant is the first thing, and this the bone marrow transplant was developed in the early 1900s. Let me see. I'm sorry. No, it was in the 1980s. The 1980s was when the first bone marrow transplant was done for Hurler syndrome. Now, the problem with bone marrow transplant is obviously it's not going to be 100% because of the risk factors involved, but also the bone marrow transplant, in order for that to happen, then the person has to be completely exposed to radiation and throughout their whole body, and it's very dangerous for the child with Hurler syndrome, especially since they're in a weakened state already. The umbilical cord blood transplant, it is actually a newer, more modern approach at curing Hurler syndrome. Or not necessarily curing, but a treatment of Hurler syndrome. And the patients that undergo cord blood transplant, they have a much higher chance of the disease being halted and the progression stopped than those under bone marrow transplant because of the nature of the transplant. Enzyme therapy is actually the replacement of the missing enzyme inside the body that will reduce the effects of Hurler syndrome. None of these transplants or therapies are foolproof. And also, once the damage of Hurler's is done, physically, as far as bone-wise goes, facial features and so forth, and even mental retardation, obviously there's nothing that we can do to rebuild those brain cells or remake the bones. So once that it's taken place, and there's really nothing that we can do. But these transplants, if done and if they work, then they can stop the progression of the disease. So obviously, early detection is a must. If you see any of the facial features, of course, the facial features can show up in the children within the first 2 years. So if you see anything like that, with the nasal bridge especially, if you see that, then immediately the child should be tested genetically for Hurler syndrome. That way, that the transplants can take place then to avoid any further mental or physical reduction. So Hurler syndrome as a whole is a debilitating genetic disease. However, with early detection and genetic counseling, it can be prevented, and in some cases it can be stopped from progressing anymore. Thank you so much for your time, and have a wonderful day.